Good evening, family. My name is Robin L. McGrady, and welcome to my YouTube channel. If you've been on this channel before, it's been a couple, about at least 30 days since I've done a video, and I'm gonna do a hard pivot here, and I'm gonna do a six-part series entitled Nursing Chronicles. I will be going back to Reimagine Healthcare. Reimagine Healthcare has not changed. I will be discussing the hypertension, the diabetes, and the stress in Black men's health. But I'm taking a pivot to do something I'm very passionate about, and that is entitled Nursing Chronicles. Nursing Chronicles is my personal experience of over 35 years of nursing in LTech, ICU, nursing home, and home health nursing. And within that time, I have garnered a great deal of skills, technology, and cultural competence. That said, you might want to stay to the end to hear what I'm going to be giving away. I'm going to give a link to those who watch the whole series, and the link is basically going to be um, a nursing assessment. The nursing assessment is not going to be your typical head to toe nursing assessment, but it's going to be the way you would strategize coming into work, the first thing you should do, the second and the third. This tip is going to be essential because it's going to save you at least 2 hours on your shift without having to stay over and do things that you could have identified early in the shift. Please stay tuned for that because it's going to be at the end of the 6-part series, that clickable link, and it's going to be printable. So without further ado, Nursing Chronicles, the first part is going to be work-life balance as a nurse. Now, this is a very important topic on work-life balance because today we're working 12-hour shifts, 8-hour shifts, maybe a 4-hour shift will turn into an 8-hour shift, and maybe a 8-hour shift will turn into a 12-hour shift. We know that the landscape is changing and evolving as we speak. We got three big things on the table. We have the big beautiful bill, which which is changing the way services are provided to nursing homes, to hospitals, and how nursing is managed overall in this landscape. So that is on the table. We also have the shortage of nursing. We have nurses coming into the profession and we have nurses leaving the profession at the same time. 3 years in, 5 years in, they say, I can't take it. You typically can see a picture of a nurse burnt out with her head down and saying, look, this is not for me. I thought this was a environment where I could help people, and nursing is that. However, some feel that they are not equipped with the tools and the support staff to manage the load that is placed upon them. So what I'll be talking about is what I did as a nurse, as a young nurse at 27, and what I would do differently at 63 years old, young, at 63 years young to make my day better. And first thing I would do, I'll just give you three tips. I'm just trying to tantalize your interest a little bit. I would come to work 30 minutes early. Why would you do that, Miss McGrady? Coming to work 30 minutes early will give you the opportunity to survey the landscape. What do I mean by surveying the landscape? Well, by surveying the landscape, you can actually see what's going on the unit. Is bed 3 and still bed 3? Is bed 3 still a patient, or has he been discharged and the information hasn't been passed down? If you work in a dementia unit, maybe a patient has gone out with his family and the information hasn't been transferred down. That is surveying the landscape. Surveying the landscapes gives you the opportunity to act now, as opposed as to coming into your shift, starting your med pass, and then a few minutes later you get the information that you could have intervened on at the earlier part of the shift. That's a golden nugget. So if I were going back to my 27-year-old self, I would have gotten to work early. But you know why I didn't get to work early? I was exhausted from working too many hours. And I was on this roller coaster of thinking, I've got to get it done. I've got to get it done. And that's simply not the case. You can take your breaks, you can eat your lunch if you're purposeful and intentional about taking care of yourself. And so that is one golden nugget that I would do as a new nurse. The second golden nugget would be I would be culturally aware or culturally competent. What do you mean, Miss McGrady? Well, cultural competence is understanding how the culture of another person. And when I say culture, I'm just not referencing ethnicity. I'm saying how a person likes their care done. In other words, if a person is saying, hey, I don't do it this way, I want you to come across the table and ask them, well, how would you like me to do it? And taking those few moments to understand what that person likes or taking the time to listen will make a big difference in your shift. A lot of times we're so busy coming in, getting the assessments, setting up our cart, and trying to face the challenges that we don't have the time to listen. So if you take the time to be culturally competent, in other words, not just learning about different ethnicities, but listening to the person and what they're trying to convey. For example, if you have a person who is not combative but resistant to having a bath, maybe that person has a history of trauma or something where they're resistant to having that bath and revealing themselves. So sometimes you can look in the chart. This is another nugget, nugget number 2, looking in the chart and scanning that chart. You know you don't have time to read everything, but hit the highlights and see what is in this chart that was not handed off in report that I could utilize for the rest of my week. Okay, now the last nugget I'm going to save for the next video, which is going to be coming up shortly. I want you to stay tuned. Again, this is Nursing Chronicles, and we are discussing work-life balance. What would I do differently at 63 if I was back at 27? I'm going to be sharing my strategy. Strategy is a word you're going to hear me use throughout the not podcast, throughout this video, because you can work hard, but if you take the time and strategize and come with a different approach, it's going to save you time, it's going to save you energy, and it's going to save your health. The one commodity that we do not have time to waste is time. Time is precious. And this is what I want to save you: some time and some wisdom. Thank you for tuning in. Please click, share, and subscribe. Peace. God bless.